Yeah. Today, tonight, we feel so nice. Anytime, anywhere, we feel so nice. Today, tonight, we feel so nice. Anytime, anywhere. Oh, mama. Kaima wanla Africa, don't be scared. Fimagak now, nyapabenala. Follow the melody, beauty, love, and harmony.
Tackling NTDs would mean equality, development, and health justice.
To me, NTDs are a group of forgotten diseases that impact the world's poorest, most forgotten people.
Eliminating NTDs is a step towards achieving the universal health coverage.
Ending NTDs means addressing the social, economic, and health disparities that continue to exist and sustain the epidemic today.
I don't know about tropical diseases.
To me, NTDs are those diseases where we really need to reprioritise our research and funding into if we want the world to be on much more of a level playing field in terms of global health.
Tropical disease which has having no strong sign and symptom, that we can say neglected.
To me means the diseases that the community and the health ministries, especially in tropics, have forgotten to care about, but they are killing vast majority of people.
NTDs to me means unacceptable inequalities.
Smile and be happy. Où que tu puisses aller en Afrique, tu te sens comme chez toi. En Afrique, talonyo chowa lerero. En Afrique, jamak salam la nyumom. Fuma jam fune, lumu sorry sama taru rew rek lay bëgg wone te ba may gune ci la xamne jomak jambar fi la ko donne. Kufinyo denga delose, harit sama aksil, kay ma weyal, begal, teral jegesil. Nga nek Senegal wala Gambia, Mali, Guinée, Niger, Mauritania, Côte d'Ivoire, Cameroon.
People must know that brulee ulcer is a normal disease which is not caused by witchcraft, a curse, a black magic. People must know the early symptoms of brulee ulcer and report to the hospital, because early detection of brulee ulcer is the key to prevent disability and other related problems.
In the year 2000, when he was just 19 years old, Emmanuel Aguma contracted a severe form of brulee ulcer. Although he survived the infection, he was left seriously disabled.
I spent almost 3 years in this hospital, receiving my treatment from this horrible disease, brulee ulcer. And this was my bed where I had 9 surgical operations. Alan.
In spite of his ordeal, Emmanuel managed to obtain an advanced degree in accounting and has now established a foundation to help others.
Having passed through all this, I said, now, I was once hopeless, but today I'm hopeful.
Brulee ulcer, when detected early, can be cured using combination antibiotic therapy for a period of 8 weeks. Community participation is crucial to improving early detection of the disease. Close collaboration between village volunteers and health workers ensures timely treatment of patients and greatly increases chances for complete recovery.
If you go to the hospital early, we can get treated so fast in order to avoid disability. They will go without complications like what some of us pass through.
Love is everywhere in Africa. Today, tonight, we feel so nice. Anytime, anywhere, we feel so nice. Today, tonight, we feel so nice. Anytime, anywhere, we feel in Africa. We feel so nice. Come on, come on. constamment. L'amour est tout ce dont nous avons besoin. L'amour est tout ce dont nous avons besoin.
Oh na nyuma nilitaka kuzungumza nawe ila nafasi yo kwako nikakosa. Sikujuta wala sikulalamika sababu na mimi kukupenda wewe japo nilisafa machozi nikangusha, hujawahi nifuta hata kwa kunyongopea. Baby ndo kwanza unacheka huku kinibeza na mashoga zako vibarazani. We mpenzi, dunia imebadilika, maana naweza
Le jour du lancement, les premiers jours et le ravitaillement, je suis obligé de couvrir les 15 villages. Et quand on réunit les 15 villages, c'est vraiment des kilomètres et des kilomètres. J'aime mon activité avec passion parce que vraiment depuis l'enfance, la santé m'a toujours plu. Ce qui fait que remplir ces tâches quotidiennement, ça ne me gêne pas. Ça fait un plaisir de rendre service à la communauté.
This is the boy classic. Oh na nyuma nilitaka kuzungumza nawe ila nafasi yo kwako nikakosa. Sikujuta wala sikulalamika sababu na mimi kukupenda wewe japo nilisafa machozi nikangusha, hujawahi nifuta hata kwa kunyongopea. Baby ndo kwanza unacheka huku kinibeza na mashoga zako vibarazani. We mpenzi, dunia imebadilika, maana naweza
इसके बारे में ऐसा था कि मतलब जैसे कहीं जाए, जब अपना घर परिवार नफरत कर रहे हैं तो गांव वाले कितना नफरत करेंगे। किसी का आंगन घर में जा रहे हैं,
फिर घर में शादी होकर के घर वाले घिन छूत करने लगे, पता लगा कि बीमारी है।
शादी ब्याह हुए बीमारी लगे, ससुराल वाले भी परिवार के और दूसरे भी जब घिन टाइप कर देखना, नज़र से बुरी नज़र से देखता है इंसान को दुख लगता है।
Dan ini juga disebabkan juga karena masih ada stigma ya, di masyarakat, ya, bukan hanya masyarakat, pada tokoh-tokoh masyarakat, kelompok potensial.
Aí tinha médico, eu fui no médico, ele disse que era reumatismo. Ele pegou e falou para mim, mandou me levantar da cadeira que eu estava, me encostasse, afastasse da mesa, pegou uma flanela, um pano, e ele despejou um álcool assim, passou assim, jogou fogo em cima da mesa. E falou para mim que eu podia ir para lá, que eu não podia mais tocar em nada. Então aquilo ali foi a coisa mais triste que eu já passei na minha vida.
तो हम लोग ऐसा इस तरीका हम लोग थोड़ा सा मदद चाह रहे हैं कि रह सके, अपना बाल बच्चा उसको अपना शादी ब्याह करके अपना कहीं अपना गुजारा कर सके। इस चीज़ का हम लोग का व्यवस्था नहीं हो पा रहा है।
It's a babe. This is when I work classic. Oneni navolia kama mtoto kwenye sekta ya mapenzi, na hisi nimechapwa viboko, na kinachoniumiza ni yangu huruma. Mwana mama bana balini, si mwanamke akikuuzi usije mpiga. Oneni ndo nasafa, huruma yangu inaniponza. Kazi yangu kufungua milango, si kwa maana ni wenzangu akigonga. Na kumpenda bado nampenda, na mvumilia kila kinitenda, na isiyo ndo nafasi anayotumia. Ishara navumilia, najua taisha. Ipo siku atagundua kubwa mimi ni wake wama, na samlipizia, nitamvumilia na nitambembeleza, nitamsaisha.
We cannot accept a new normal in which progress against NTDs is put on hold.
We want to make sure that NTDs contribute to WASH. NTD contributes to One Health. NTD contributes to education.
Really allowing the energy, the creativity, and the ideas of young people to be part of the solution.
Water is a human right. Water is linked to the racial justice agenda. It is racist that we don't have water and access to hand washing for everybody on this planet.
So I just want to say we need to continue to innovate.
Mental health conditions and NTDs are highly interdependent.
The skin NTDs require a holistic multisectoral approach in order to address both the physical and psychological impact.
An understanding that we really have to work together, and that increasingly we have to include environmental health.
Today, tonight, we feel so nice. Anytime, anywhere, we feel so nice. Today, tonight, we feel so nice. Anytime, anywhere. Oh, mama. Kaima wala Africa, don't be scared. Fimagak now, nyapa benala. Follow the melody.
Good morning, good afternoon, and good evening, everyone, and welcome to the launch event for the NTD Roadmap 2021 to 2030. I'm Patricia Amira, and I will be hosting this afternoon together with my colleague across the studio, Henry Bonsu. We're delighted to have so many of you joining us from across the globe. Now, we have interpretation in 6 languages: Arabic, English, Chinese, French, Spanish, and Russian. Details are on the screen right now. The agenda overview for the afternoon is also on screen, and you can also find it at the WHO website. Okay. Now, the roadmap is a collaborative effort, and as such, hearing your voice, letting you have your say matters immensely. As such, we have a Slido poll. Go to the slido.com and use the hashtag NTD Roadmap as the password. There you will see the 2 poll questions that we'd like you to answer. The first is, how have NTDs affected your life? And what would ending NTDs mean to you? You can log in at any time during or after the event to take part in the poll. And of course, your answers will be used for social media after the event. I will now hand over to you, Henry. Busy schedule we've got going today.
Very much so, Patricia. Asante sana. Greetings and good afternoon to you all. It's widely accepted that NTDs are diseases of neglected people, as these voices from the field will explain.
Kaporenating anamak taushei de kakure kabode ngaburumere chewok kiye abamanga na chang taushei mauket.
It leads to irreversible blindness. Since we are few, I have to do what I can do to help my people. Whenever the community appreciates our program, we feel happy.
We don't do it actually because we are gaining out of it, but we feel it is our role. It was my call to do so.
Together with the team, we're able to make the place a better place for helping the needy.
Sometimes I may spend 8 or 9 hours in the water. Before I started working here, I used to feel okay, I feel strong. And there are some that now I cannot do. I just feel tired. It's like you are growing old.
What an hour Niro, Abanganyanagamalabu. Maron Yerangolo. But another scene again. Now, my Marasa is in again. You think you say, you think you say, I don't know, never mind too.
Ojú ẹ̀ ó wá bẹ̀rẹ̀ sí yún mi, ilẹ̀ àtún gbám, màá tún dúró, kí lélẹ̀ ni mo ṣe wà nílé. Màá ṣiṣẹ́ káàkiri torí àmì kápítà. Òsì kan tí mo ṣe. Mo ṣàbọ̀ wà nínú ẹ̀ báyìí mi ò kì í ṣe pé mo ní pàtó yìí sí ká lè mú jáde láti lè rí pé a jẹun lóòjọ́.
Macam mana temu rabdomi, mana temu nyal, mana temu piwi, boga dit, yana kai tingin kerai. Saya caronus, nala saya dah caronus leben, karem kogogan, wajah lah kuthaj bay. Hud, amal tak ham sayom, kareman. بين وقاو كاكل جنين يوم الخامس الجنة بين السادس جاء جود جاء عاد سرير جان باي شاركو جان من كوريا جان باي في مستشفى عم شلقو.
Ini am sinadwale pa marenda likojo marenda njoka zamini marenda dwala. Ini mene madwa marenda mene wani mava kukweteka kwa mtoto. Nimachira somata kama bwela ku skulu nimavako bwino olokapita so kunyumba makasewera nimavako so bwino bwino ineme madwala nalandirapo simankhwala ameneyo ine naona kusintha zona kuti Sininkabanga chimbuzi chophatikiza ndi magazi. Antalandira mankhwala namva bwinobwino.
Pulogulaamu y'okwejanjaba obulwadde ya mugaso mu ggwanga lyange kubanga abantu abanga balwadde tebasobola kukola mirimu egy'enjawulo. Okugeza nabo abalwadde nga balina bilharzia baba tebagenda ku ssomero nga bafiirwa okusoma ate n'enkola yaabwe mu by'okusoma eba nnafu. N'abantu ba bulijjo bwe baba abalwadde tebasobola kukola mirimu egibawa ssente. Ekitegeeza nti eggwanga liba lifiirwa ssente, abantu bandi bawa omusolo. Ate n'abalwadde era eggwanga liba lifiirwa okulaba nti libawa obujjanjabi liba lifulumya ssente.
Kupinya chamenu na ko wer kyale. Ne chamena. Panchol unde ngatur. Tu ga chi der lek. Wajala ku jalo ngain to kana. Ku jala ga choko gut. Wajala ban be ku jamer ka jating pe. Jarian gua ku recho. Wati ga po ya ti ga ka ya chol. Wajaban ku chin ka pinya chi jawe. Jawe ku tawe choko nu pe kita. Japim jada takaro. Jawebe. Jogo no indol jogo ja. Yoru chat. Wajabeba.
Bilharzia yali yazzeeko mu kitundu n'awulikikako nga akutte ku bantu ne wanga awaka wennyini n'akwata ku baana naye nga twafuna obujjanjabi okuva mu VHT mu nkola eyateekebwawo gavumenti ey'okugaba empeke. Naddala bwe baateekawo ekyokutambula nju ku nju nga bagaba empeke ezo ate era n'okulumba abaana ku masomero gye basomera era nga bongera okubagabira empeke za bilharzia.
Waktu penyakit kusta menyerang saya, waktu itu kena di saraf, terutama di tangan ini. Cuma kan kalau bilang ini mutapena, cuma waktu penyakit itu menyerang, waktu petugas kesehatan dari puskesmas datang mau periksa kita, serta dapat mereka periksa kalau kita dapat penyakit kusta, keluarga saya, kakak dan orang tua saya, mereka juga mendapat penyakit kusta. Jadi tapi perasaan sedih dan mau dengar itu kalau orang satu keluarga sini mendapat penyakit kusta.
अपने गमछा से पोछ पाछ करते रहिए, पहले बार भी पोछ पाछ कराई, बीच में और बढ़त में इतना दिक्कत हो गई कि कुछ कहीं में कहना। अब तो पहले तो कोई काम भी करते, अब कोई काम भी ना हो छै। अब ओजन बहुत हो गई, ओजन में देखियो कि कितना ओजन आ गई छै। सुनी ना, साफ हर समय साफ रख छिए, वो मदद करे छी बेचारी अपराधा का घूम का की दिक्कत है। कहियो मलम दे दिलन, देखलन कि घाव हो गए तो मलहम दे दिलन, कहियो लगा लन, कहियो न होल तो अपने से गोर भी धो देलन।
Ya memang kebanyakan orang bilang taruh rumah sakitnya di kasih sendiri, jauh dari penduduk. Kami bilang itu penyakit kutukan lah.
Belum tahu sih, saya cuma tahu itu penyakit kulit no. Saya dulu malu dan saya menutupi itu kulit yang terkena kusta. Ada note teman udah komentar, dia tanya itu penyakit apa. Orang bilang nama tajangke. Tawadeka dong pikir. Kalau lain tawadeka nak apa no, bermain sama-sama dengan orang.
Yes, it is. It's about keeping the voices of the people who suffer from NTDs front and center, and ensuring the NTD community employs the best possible means to, so that their needs are met. Now, it is a special occasion, and with it, wonderful messages of support are coming in, some of which we'll get to share with you. We have received a written statement of encouragement by Her Excellency, Ms. Amina J. Mohammed, the Deputy Secretary General of the United Nations and Chair of the United Nations Sustainable Development Group. Her statement will be read by Dr. Ren Mingui, Assistant Director General for Universal Health Coverage, Communicable and Non-Communicable Diseases at the World Health Organization. Dr. Ren, you have the floor.
Neglectable diseases continue to affect over 1 billion people worldwide, mainly in the poor and marginalized populations. Marginalized community, besides inflicting immense suffering and cause lifelong disability, NTDs also lead to stigma, inequality, and discrimination with huge mental health implications. Increasing access to diagnosis and treatment is essential, but it is not enough. More needs to be done in terms of cross-sectoral interventions and One Health. It is the underlying vision of NTD Roadmap 2021 to 2030 being launched today. The new NTD Roadmap is innovative and offers a powerful contribution to the Sustainable Development Goals, and especially universal health coverage. It addresses vulnerability, and by doing so, it promotes equity. But its ambitious targets cannot be achieved unless we unite and act together with ambition. That's the end of statement.
We thank you. Now, as we've just heard, it's all about building resilient, sustainable health systems in order to meet the needs of the most vulnerable. To introduce the Director General of the WHO, Dr. Tedros Adhanom Ghebreyesus, to give his keynote address.
Thank you, Patricia. And very nice to see you, Henry. And glad to join. Distinguished guests, dear colleagues and friends, it's a pleasure to join you today for the launch of the 2021 to 2030 Roadmap for Neglected Tropical Diseases. The roadmap was developed through an extensive consultative process and approved in November by the World Health Assembly. It sets global targets and milestones to prevent, control, eliminate, and eradicate 20 NTDs and disease groups. By shifting away from single disease programs to integrated approach, it aims to improve coordination and collaboration. The 2030 global targets of the roadmap are, first, to reduce by 90% the number of people requiring treatment for NTDs. Second, to enable at least 100 countries to have eliminated at least one NTD and to eradicate drunkenculiasis and yaws. And third, to reduce by 75% the disability-adjusted life years related to NTDs. The roadmap promotes cross-sectoral action in areas such as health, education, nutrition, and One Health. The roadmap also addresses stigma, discrimination, and mental health conditions, which are often neglected consequences of disability. Tackling NTDs are a challenge for countries, but they're also an opportunity to address the health inequalities that undermine economic and development progress. In the end, a roadmap is only a guide. We can only reach the destination with country ownership. That means national and local governments working in partnership with communities and youth. Accountability is key. By working together, we can prevent suffering and save lives. This roadmap shows us the way. Asante sana. I thank you.
Thank you very much indeed, Dr. Tedros, and it's a pleasure to see you too. It's time to take a stock take. The first NTD roadmap was launched in 2010. Happily, much progress has been made since then. Let's hear from two former directors of the Department for Control of NTDs at the WHO, who have helped shape this progress over the last 10 years. First, let's hear from Dr. Lorenzo Savioli.
The first roadmap was the outcome of a firm commitment of the former Director General, Dr. Margaret Chan, to continue WHO's leading role in prioritizing NTDs after the premature death of Dr. J.W. Lee. It was Dr. Lee's efforts that led to the definition of the concept of NTDs, following the two scientific meetings in Berlin in 2003 and 2005. The outcome was the establishment of the NTD department in 2005. In 2007, the first Global Partners meeting brought together the diverse partners, resulting in important pledges and donation of medicines. In 2010, WHO produced its groundbreaking global report on NTDs. For the first time ever, the world was presented with a much-needed data on the burdens of NTDs. In January 2012, WHO published its first roadmap on NTDs. Inspired by this blueprint, partners endorsed the London Declaration, leading to increased commitment and the setting up of United to Combat NTDs partnership. First roadmap was triggered the need for a comprehensive resolution of all NTDs. In 2013, the World Health Assembly adopted Resolution 6612 that assured the full backing of member states to the 5 strategic approaches developed by the NTD community and WHO for over 40 years and embodied in the first roadmap. My message to all of you is to continue in the footprints of the past with innovative thinking and the analysis of successes and failures. We should not forget that to become policy, public health experience needs the endorsement of member states through World Health Assembly resolutions. The consultative process that led to this new roadmap enabled WHO to convene a robust group of technical advisors. This was time-consuming but important to allow them to speak their mind and not to cover their opinion by political correctness. WHO cannot achieve its goals without the support and reciprocal respect of its partners, especially member states, and the public and private sector, more importantly the pharmaceutical industry. That has been the formula for success of the NTD movement and of the NTD department. I am glad to see that these footsteps are followed with the necessary innovation by the colleagues now in charge. I wish you all success in the implementation of this new roadmap.
Those wishes are gratefully received, Dr. Savioli, and thank you for pointing out that although the report was published in 2010, the roadmap itself, the first one, was published in 2012. Now let's hear from another former director of that department, Dr. Dirk Engels.
The first roadmap, supported by the London Declaration, was a clear, well-thought plan to accelerate interventions and widen access to treatment. It inspired many and established NTDs as a brand and as a global success story. This is evident right from the number of people treated. That has been exceeding 1 billion for 5 consecutive years now. It provided the much-needed visibility and advocacy for diseases that were almost unknown. It attracted partners, generated new funding, strengthened political will, and stimulated communities. In short, it was a game changer that built a broad, robust public and private partnership. Its achievements have anchored NTDs in the Sustainable Development Goals, with a specific indicator and with a perspective for more action on the underlying determinants of NTDs, so that by 2030, no one will be left behind. In 2017, during the Global Partners meeting, we made it clear that the new roadmap should embrace integration and cross-cutting interventions. We are glad this new roadmap embodies this change and bolder cross-sectoral action on human, animal, and environmental health. Even if this is a challenging goal, it will be a driver with many collateral benefits on NTDs, but also on diseases with epidemic potential that the world has learned to fear so much. The integrated, well-coordinated, and collective action of this new roadmap has the potential to end NTDs. So let's work together to achieve this.
Thank you very much, Dirk, and previously to Lorenzo. It's great to hear how the fight against NTDs has progressed over the years, and really good to note the lessons learned. Now, opening remarks have been provided by His Excellency Fio Gnassingbé, President of Togo. As His Excellency is currently not available to join us live, his speech will be read by Her Excellency, Madame Victoire Tomega Dogbe, Prime Minister of Togo. Madame, the floor is yours.
Madame la vice-secrétaire générale de l'Organisation des Nations Unies, Monsieur le directeur général de l'Organisation mondiale de la santé, Mesdames et Messieurs les ministres de la Santé, Mesdames et Messieurs les partenaires de la lutte contre les maladies tropicales négligées, distingués invités. Le monde traverse une crise sanitaire sans précédent. Ses conséquences et les incertitudes qu'elle provoque pour nos populations ne doivent pas nous empêcher de préserver nos acquis et avancer en matière de préservation de la santé. Au nom de son Excellence, Monsieur le Président de la République togolaise, qui m'a fait l'honneur de me désigner pour le représenter à la présente session, j'adresse mes sincères félicitations au secrétariat général de l'Organisation mondiale de la santé pour la tenue de cet événement consacré à la présentation de la nouvelle feuille de route lutter contre les maladies tropicales négligées pour atteindre les objectifs de développement durable. Feuille de route pour les maladies tropicales négligées 2021-2030. En effet, cette rencontre vient nous rappeler que les maladies tropicales négligées affectent des populations vulnérables avec un impact social, économique et humain, notamment le handicap et la perte de productivité. C'est le lieu de saluer le rôle primordial de l'Organisation mondiale de la santé dans la lutte contre les maladies tropicales négligées. Depuis la déclaration de Londres en 2010 et surtout le lancement en 2016 à Genève du programme spécial élargi pour l'élimination des maladies tropicales négligées en Afrique, la lutte contre les maladies invalidantes a connu une accélération. Le Togo a obtenu des succès remarquables ces dernières années, à travers notamment l'élimination de la filariose lymphatique en 2017, de la dracunculose en 2011 et de la trypanosomiase humaine africaine en 2020. Ces résultats, obtenus grâce à l'appui technique et financier de nos partenaires et à la mobilisation des acteurs nationaux, ont permis à des milliers de nos concitoyens d'être libérés de ces maladies qui impactaient négativement leur vie quotidienne. Soyez-en tous remerciés. Afin de pérenniser ces résultats, le Togo, sous la haute impulsion du chef de l'État, a élaboré pour les 5 prochaines années une feuille de route centrée sur l'inclusion sociale. Au rang des actions prioritaires, l'accès universel aux soins pour les populations, qui comporte tant l'assurance maladie universelle que le rapprochement des centres de santé des populations. C'est donc naturellement que nous adhérons pleinement à la feuille de route 2021-2030 de l'Organisation mondiale de la santé relative à la lutte contre les maladies tropicales négligées. Nous invitons tous les pays et les partenaires de cette lutte à travailler en synergie afin de parvenir à éliminer à terme ces maladies qui constituent des drames pour les populations vulnérables. Ensemble, nous pouvons arriver à soulager ces populations et leur redonner espoir sur le chemin de la vie. L'organisation de la lutte contre les maladies tropicales négligées et sa réussite ont fait appel à la participation des communautés qui y ont contribué. Je voudrais ici rendre hommage aux agents de santé communautaires et tous les acteurs locaux pour leur engagement auprès des populations cibles en vue de l'amélioration de leur santé. Chaque pays, à cette étape, doit s'approprier la lutte contre les maladies tropicales négligées en investissant en complémentarité des partenaires tout en évoluant progressivement vers une appropriation nationale totale. Le Togo remercie l'Organisation mondiale de la santé pour son appui technique et financier, ainsi que tous les partenaires pour leur précieuse contribution à la lutte contre les maladies tropicales négligées. Permettez-moi de conclure en disant que de ces expériences réussies, nous tirons la confiance nécessaire et suffisante pour rester optimistes face à la pandémie actuelle qui soumet notre action collective à une très grande épreuve. Je vous remercie.
Je vous remercie aussi, Votre Excellence. Thank you very much, Madame Dogbe, for providing those remarks on behalf of President Faure Gnassingbé of Togo. Now, in a moment, we'll have further insight from a country perspective. But first, let's have a musical interlude from Damien Soul of Tanzania.
Apa maksudnya?
Insecurities, ugly histories are consuming your mind. Broken promises, everything he said you ask, it's the best left behind. Insecurities, ugly histories are consuming your mind, your mind, your mind. Broken promises, everything he said you ask, best left behind. What if I told you that yesterday is gone? What if I hold you and love you as my own? You don't have to be
Perfect. Thank you to Damien Soul, sharing a message there about keeping focus and, of course, the need of working together, the means of strengthening our goals, a key theme of the roadmap. And I think a perfect intro to our next speaker as well, who knows much about this, given a long shared history in the fight to eliminate NTDs. So without further ado, I now invite the Canadian Minister for International Development, the Honourable Karina Gould, to give us a country perspective on progress.
I want to congratulate the World Health Organization and all of its partners on the roadmap on neglected tropical diseases for 2021 to 2030. This new roadmap encourages a fundamental shift in focus from disease-specific programming to integrated approaches. This will help us achieve better and more sustainable results, build stronger, more resilient health systems, and move toward universal healthcare for all. Neglected tropical diseases continue to have a disproportionate effect on vulnerable women and girls. So I challenge this global community to keep equity at the center of NTD programs and interventions. We need to encourage greater integration of gender equality, human rights, and the participation of women and marginalized communities as partners in all of our actions. We know that ensuring everyone has a seat at the table will make our collective efforts more effective. Thank you.
And thank you for your continued support, Karina. Now, we're going to continue on this path, discussing different aspects of progress. Dr. Naseem, if I can come to you first. Your country has made remarkable progress in public health. What are the three main achievements about NTDs?
Maldives has made great strides in protecting the population against neglected tropical diseases. I believe we have achieved all three targets set forth in the Global Leprosy Strategy from 2016 to 2020. Back in the 1980s, Maldives was actually classified as a high leprosy endemic country. However, this changed with the introduction of multi-drug therapy. As a result, we were able to eliminate leprosy as a public health burden by 1997. Our latest target is to ensure Maldives receives the zero leprosy status by 2030. We will do this by following the zero leprosy framework. Additionally, Maldives became the first country in the South and Southeast Asia region to receive certification for having successfully eliminated filariasis as a public health burden by 2016. Furthermore, a study conducted in 2018 revealed a low prevalence of soil-transmitted helminths amongst school children. We can actually contribute this to the improved sanitation, access to clean water, and other proper hygiene practices in the Maldives.
So what's your formula for success?
Our formula for success. Our formula for success must be created to island community involvement and support that they have given to these kind of projects in Maldives. Also, credit goes to the government of Maldives for being steadfast in guiding our communities on the path to successfully eliminating neglected tropical diseases by aligning the needs of Maldives to our international commitments. Our health agenda must remain the center of our sustainable development goals. We make our decisions based on evidence and create country-specific plans supported by health professionals. I believe with this strategy, we will move in the right direction to winning our battles against neglected tropical diseases and other similar communicable diseases. From the very beginning, the government's focus has been on eliminating diseases by outlining clear objectives, bringing about changes required within the system. This enables us to sustain the efforts in preventing reintroduction of neglected tropical diseases. I would also like to emphasize that we are committed to sustaining our efforts in controlling and preventing neglected tropical diseases. We do this by keeping in mind our past experiences and replicated strategies that proved successful. Having said that, we are geared towards control and prevention of arboviral diseases such as dengue, which contributes as one of the major diseases that is burning this country today.
Okay, thank you so much, Dr. Naseem. Now, following on from what Naseem has just said, you could share further insights into what small island states have learned in the control and elimination of NTDs.
Vanuatu historically has had 7 endemic NTDs. 4 have been targeted for elimination. They are leprosy, lymphatic filariasis or LF, EOS and trachoma. And 3 are for control, dengue, scabies and intestinal helminths. Vanuatu has been working to tackle NTDs since 1997, starting with LF elimination program. And by 2016, we have successfully eliminated LF. And by 2019, we have achieved the target for eliminating trachoma. We have accelerating efforts to control and eliminate other remaining entities such as EOS, leprosy, and scabies.
And then how can these lessons be shared with other countries?
With these achievements, Vanuatu has shown to the global community that controlling and eliminating entities is achievable because of the following factors. Number 1, a strong political commitment from the government. Secondly, a strong leadership within the ministry and effective coordination with other ministries such as WAS, livestock and education sectors for joint planning, implementation, monitoring and response towards and against such targets, shared targets. Close working relationships with donors and partners and the technical advice of WHO, including the WHO roadmap strategies and guidelines. Fourth, community leaders' commitment to ensure high treatment coverage during mass drug administration campaigns. Finally, dedication of health workers to monitor the situation related to entities and to treat the community.
Mm-hmm. And then, so what are some of the potential threats to sustaining achievement?
The sustainability of the program is always a challenge due to limited domestic resources, high cost, logistic cost due to the remoteness and of effective communities, shortage of health professionals, and the fact that we are dealing with multiple co-endemic entities and frequent natural disasters, now compounded by the economic hardship that has resulted from COVID-19. Nonetheless, the Ministry of Health has been making a commitment to establish and sustain the NTD position within our ministerial structure and allocated 1.6% of our budget to complete an unfinished business of controlling and eliminating all entities.
Now, Dr. Singh, let's move on to you. You have made elimination of NTDs a flagship program for your region. How do you see progress so far?
In 2014, the WHO Southeast Asia region identified 7, now 8 flagship priorities, one of which was finishing the task of eliminating NTDs and other diseases on the verge of elimination. Together, WHO and its member states and partners in the region have made tremendous progress, fundamentally changing the global NTD landscape. In 2016, India was declared EOS-free. Maldives and Sri Lanka eliminated lymphatic filariasis as a public health problem, which Thailand also achieved soon after. Bangladesh is now under post-MDA surveillance and is preparing a dossier for elimination. In 2019, Timor-Leste became the first country in the region to successfully implement the first round of the new triple drug therapy for lymphatic filariasis across the entire country. India expanded its initial implementation of triple drug therapy into 23 districts and has plans for more. In 2018, Nepal eliminated trachoma as a public health problem, which Myanmar achieved in 2020. All Kala Azar endemic districts in Bangladesh have now achieved the elimination target, and India and Nepal are on the cusp of eliminating the disease. The region continues to make strong progress against leprosy, reflected in Maldives' ambition to achieve zero leprosy status. Indonesia has reduced the prevalence of schistosomiasis to very low levels. Visceral leishmaniasis, trachoma, and lymphatic filariasis have all been slated for elimination as a public health problem and yours for eradication. In pursuing our flagship priorities, the global NTD roadmap and the 500 billion and SDG targets, WHO and its partners continue to identify and leverage high-impact innovations, including the rollout of e-learning modules on leprosy management and the development of the same for LF morbidity management and disability prevention. The region's progress has indeed been immense, and we look forward to supporting our member states to not only sustain but also accelerate their many gains to achieve a healthier, more equitable region.
And, you know, inequality and how it plays out in health systems through to lack of safe, clean water is a huge consideration in health in general. So how has such progress contributed to addressing this in Southeast Asia?
NTDs typically affect the poorest and the most marginalized communities, entrenching a cycle of poverty and neglect that is harmful to health, well-being, and sustainable social and economic development. By targeting NTDs as a flagship priority, WHO and its member states and partners have helped break that cycle for millions of people across our region, reducing disabilities and increasing the chance for hitherto poor and marginalized populations to live healthy and productive lives. World Bank data show that 8 of the region's 11 countries are lower middle or low income countries. The region will continue to ensure that NTD diagnosis and treatment is completely free of cost and will continue to promote policies that help affected people avoid financial hardship, for example, through the provision of financial benefits. We will continue to promote policies and programs that secure stable livelihoods for people who have incurred NTD-related disabilities, and will continue to champion such policies within our elimination and eradication strategies. The SDGs underscore the fact that health is both an input and output of sustainable development, and call on us to ensure that no one is left behind. You can be certain of WHO's ongoing commitment to that outcome and to achieving our flagship priorities, the global NTD roadmap and the 500 billion and SDG targets.
Thank you, Dr. Singh. Now, moving to you, Mohammed Al-Pateh, neglected tropical diseases are deeply anchored in poverty. What is the World Bank's perspective on poverty-driven diseases?
The World Bank agrees wholeheartedly that neglected tropical diseases are anchored in poverty and lock people into a cycle of ill health, poor education, and lack of opportunities, positioning neglected tropical diseases, or NTDs, as a key threat for building a country's human capital and for progressing towards universal health coverage. Health is foundational investment in any country's human capital, and putting people at the center of the country's plan is the key to ending extreme poverty and creating more inclusive societies. NTDs have long-term consequences that can cause visual and physical impairments, leading to disabilities that place an overwhelming financial burden on households and the loss of productivity, which become a burden on national economies. This is, in part, due to the costs of seeking healthcare, which not only include out-of-pocket spending on consultations, laboratory work, and medicines, but also transportation costs and informal payments to providers.
Now, both the World Bank and WHO advocate for investment in primary healthcare. How is such an approach contributing to tackling these diseases?
We all know that primary healthcare is the cornerstone of high-quality health systems. And much of the World Bank's work has been focused on ensuring equity of access to essential health services, building robust health systems, and expanding financial protection for the poorest people in countries. Primary healthcare is the most cost-effective way to address comprehensive health needs in an equitable way. And this cannot be even any more important than with regards to neglected tropical diseases, since they affect the most vulnerable and marginalized and poorest people in our societies. It is for that reason that the World Bank has been promoting the integration of deworming in health packages for UHC to not only improve the health of the population, but to also ensure higher current and future productivity levels that are needed for human capital development. The World Bank has been very active since 1970s in reducing the burden of neglected tropical diseases and has committed over $160 million to date on a combination of national and regional programs that address neglected tropical diseases. Since 2015, our efforts are concentrated in supporting our client countries to increase sustainable domestic financing for deworming, to integrate deworming in UHC packages to strengthen their primary healthcare systems. This has led to annual bank investments from 2015 to 2019, signaling deworming as a best buy in development.
Thank you for that. And finally to you, Khaled, the Kuwait Fund has supported projects in so many different countries since the mid to late 80s. I'm talking about the guinea worm eradication program. What motivated you to fund NTDs, and how have you maintained the momentum over such a long period of time?
Thank you, Patricia. It is indeed an honor for me to attend the launch of Neglected Tropical Disease Roadmap for the years 2021-2030, a very important document for us all indeed. A document that will support the implementation of programs for the control, prevention, elimination, and eradication of NTDs globally. And we proudly congratulate WHO on their achievement during the previous roadmap for the years 2016-2020. And thank you also for providing this opportunity for me to say a few words about Kuwait Fund's involvement in this field. Kuwait Fund has been participating in the financing of disease control programs globally since 1974. As an active member of the donor community committed to fighting against onchocerciasis, as we recognized back then the importance of giving neglected tropical diseases the proper attention and support needed. As a relatively unknown issue to the public, and indeed at one point on an international scale, the Kuwait Fund recognized the importance of addressing such an important yet ignored plight. Our continued commitment to the issue can be noted via our historical involvement in this domain, as Kuwait Fund has attended every meeting concerning onchocerciasis to date. We also took a consulting role at the first roadmap for NTDs and hosted the first multi-donor conference in Kuwait in October 2017. Kuwait Fund is also one of the co-founders and early financiers of the expanded special program for the elimination of neglected tropical diseases, ESPIN. All that and our momentum within these endeavors over the years have been helped in no small part by our continued collaboration with various health programs and other implementing partners, a testament of our successful collaboration and committed dedication over the past 45 years. To name a few examples of such collaboration, Kuwait Fund has proudly supported the River Blindness Control Program in Africa, the Foundation for Tropical Diseases, the Worm Eradication Program, and the expanded special program for the elimination of neglected tropical diseases. Indeed, Patricia, Kuwait Fund has been steadfast in its support for disease control programs over the years. The main drive behind such involvement is certainly solidarity and the belief that it is our moral obligation to help those suffering from such preventable, horrible diseases. We are also driven by our principal desire to contribute to the betterment of people's lives and investing in their well-being. Furthermore, and as it is clear to us all that healthy individuals make healthy and productive communities, and that health is a crucial element in the social and economic development of nations. And it is in this standpoint that Kuwait Fund, since its inception in 1961, has been intentionally focusing on improving the health conditions in our beneficiary countries by financing development projects that improve access to electricity, water and sanitation, health and education, and other crucial infrastructure. We are extremely proud of the achievements of the various well-run programs that have effectively sustained their activities over many years, as they have helped save millions of lives. We also would like to express our recognition and appreciation of the great strides taken collectively within the African continent towards fighting against neglected tropical diseases. I would like to seize this opportunity to highlight the importance of fighting NTDs through our continued concerted efforts and commitment. This partnership is an exemplary case of international cooperation for addressing not only health issues, but also development concerns as well. And I wish for our continued success in tackling and hopefully one day eradicating all neglected tropical diseases. Thank you for your kind attention.
Thank you so much. Thank you so much, Khalid. And of course, thank you to all our panelists for giving us all a glimpse of the lay of the land in their respective countries and regions. Now, turning to something that's affecting us all, a short video showing the impact of COVID-19 on NTDs.
It's important to see that the work of the fight against NTDs continues apace despite the advent of COVID-19. Now, the critical factor in all of this is, of course, robust primary healthcare systems, as Ali Pat said earlier, and its importance in meeting the SDGs and universal healthcare. Dr. Ren Mingui, Assistant Director General of Universal Health Coverage for WHO, feels strongly that ending NTDs can play a key role in meeting these targets.
Distinguished representatives, dear friends and colleagues, thank you for this opportunity to speak at this launch of NTD Roadmap. Globally, over 30 diseases are targeted for elimination or eradication by 2030, most of which are neglect tropical diseases. The diverse set of 20 neglect tropical diseases or conditions affect more than 1 billion people worldwide, affecting the most vulnerable and marginalized populations. By eliminating NTDs, we will not only improve health, but we will also reduce poverty, and we will improve equity, prosperity, and well-being. NTD responses are built on the vision of universal, equitable access to health services. Through the NTD programs, we are able to reach the world's poorest and most hard-to-reach communities, including those affected by complex emergencies. We have witnessed the devastation of COVID-19 pandemic on the health systems of many countries. The NTD roadmap aims to mitigate the impact of such pandemics on the NTD response. NTD programs provide essential health services that would otherwise not be available to such marginalized communities, mostly free of charge. Through the mainstreaming NTD programs into primary health care, we will build strong and more resilient health systems that are achieving greater impact. The notion of equity is the essential element of NTD programs. The roadmap promotes community inclusion and empowerment, essential for achieving equity, ensuring accountability, and building for the future. The roadmap is a shared vision involving all stakeholders. It provides opportunities for collaborations across NTDs, veterinary public health, agriculture, housing, climate environment, and integrated vector management. Furthermore, it provides important models for promoting integrated approaches to multi-disease elimination within the framework of universal health coverage. With that, I thank you very much for your attention.
Thank you indeed, Dr. Mingui. We'll now take a short break before the next panel session. And don't forget in the meantime to go over to Slido to take part in the poll. Remember those two questions. How have NTDs affected your life? And what would ending NTDs mean to you? Now, Mark Joshua Ouma, better known as Teardrops, is a poet and spoken word artist from Nairobi. He's headlined numerous poetry and arts events over the course of his career, and we are delighted to bring you a bespoke performance he recorded for Youth Combating NTDs.
Mahatma Gandhi once said, "The true measure of any society is seen by how it treats its most vulnerable members." I've lived in two worlds. I've seen the wonders of the world. I've seen men go to the moon and back. I've seen men building the greatest wall. I've seen men drilling the deepest hole. I've seen men not asking for a cup of water but Wi-Fi passwords. I've seen men finding water on Mars. I've seen it all. So what's the need of men going all the way to Mars to find water and a fellow man on Earth can't find water? I refuse to live in a world where it's easy for an army to disperse protesters with water cannons that have clean water, but it's hard to combat parasites that are living in water. I refuse to just stand and watch diseases with complicated names trying to complicate lives. It's sad to watch diseases that you only read about in theory being practical on bodies of the people that you care about. We can't afford to fail both on our biology exams and also fail in taking care of ourselves. See, where I'm from, our drinking water is not only polluted, it's also electrocuted. And if I tell you how many people die from drinking water, you'll be shocked. I refuse to live in a world where sewer lines, clean water lines, and illegal power lines run concurrently, apparently. I refuse to live in a world where men stay up late to watch 22 people kicking a ball, but there's a million people out there with legs too heavy, with the size of a ball, and nobody's having sleepless night. I refuse to live in a world where we have free waterfalls, but not free water for all. I refuse to live in a world that the water we flush in our toilets are 100 times cleaner than the water that other people are drinking. I refuse to be in a world where the water in swimming pools are getting a much better treatment than the water that our fellow men are drinking. And those are the things that make me sick. A man going without food for 3 days and without water for 7 days doesn't make someone strong, it makes you weak. I refuse to live in a world where politicians can go to the driest part of the continent to look for votes, but not to distribute medicine or information to those that matter the most. If water can make it to the mountain, through rivers, to villages without proper channel, why can't men do that? I refuse to live in a world where creatures that can't be seen growing bigger than Hollywood movies and start creating sin. I refuse to stand and watch water taps running and others can't find water. If water is life, it's so sad now it's included in 1,000 ways to die. So when you go to sleep tonight, I want to think about the people with worms that even early birds are afraid to catch. And if faith heals, I think we should create more hospitals in the church.
I want us to think of the neglected people living with neglected tropical diseases.
I would now like to introduce our next panel, addressing the question, how has partnership catalyzed success? I need this to move. On the panel with me, Dr. Katie Owen, Director of NTDs at the Bill and Melinda Gates Foundation, Emily Wainwright, Senior NTD Advisor, Global Leadership and Coordination at USAID, Ms. Tsitsi Masiwa, the founder of Higher Life Foundation, Dr. Greg Perry, Dr. Kizito Ogusan, Chair of the NNN, NTDs, NGO Network. I won't get it out. Dr. Greg Perry is next, Assistant Director General of IFPMA, the International Federation of Pharma Manufacturers and Association, and John Amwasi, the Executive Director of the African Research Network for NTDs Live. I can start with you, Dr. Owen. The Bill and Melinda Gates Foundation has largely defined the role private philanthropy can play in dealing with global public health. How has your approach to supporting innovative ideas and approaches helped in tackling NTDs?
As you all know, impressive gains were made in the pursuit of our last roadmap. Even so, we did not achieve many of the 2020 roadmap's targets, even before COVID-19 changed everything. Our last roadmap showed that reaching our goals is not inevitable. Still, I'm cautiously optimistic that this time will be different. Not just because we are working together as a community better than ever, but also because we are being smarter, focusing our science and innovations both on global disease perspectives and on country-driven and country-led solutions. Now, more than ever, innovation is critical, from research and development of new diagnostics and products, to how we implement programs and how we advocate for NTDs. We will not finish the job with the tools we have now. Take onco as a simple example. It's hard to believe that for an ancient disease, we still don't have a drug to kill the adult parasite, nor a better diagnostic than the archaic skin snips. Investing in product innovation is one area where philanthropic partners, like the Gates Foundation, can take risks where others cannot. Second, we must innovate in how we implement NTD programs. That means things like leveraging new microplanning strategies and digital tools, and investing in delivery platforms that benefit multiple diseases and integrate into health systems. Third, we need fresh approaches to resource mobilization, both for donors and for domestic funding, not least in an environment where COVID-19 has strained budgets and political attention.
That's facing the global development community in achieving the new roadmap targets, Katie?
Rejecting business as usual is never easy, but this community has proven time and again that with strong partnerships, we can defy the odds. To finish the job in which we've all invested years of time and hundreds of millions of dollars, we must continue to work together even more. Luckily, we have amazing examples of partnerships to build from. Take WHO AFRO's ESPN, which works with African governments to implement effective and efficient drug delivery programs focused on data. Or look at the long-standing partnerships between WHO, pharmaceutical companies, and implementing partners, which allow over 1 billion NTD treatments annually to reach people in need, and ultimately have led to 33 countries eliminating at least one NTD. And all of this is possible because of the long-standing commitment of donor governments like the US, the UK, and the UAE, and also private philanthropy organizations like the End Fund. Almost a decade after the London Declaration, the new roadmap is ushering in a pivotal new chapter where countries will lead the way, our partnerships will work smarter, our innovations will be targeted to impact, and where we will focus on the health of people and systems to create a world without NTDs.
Thank you very much, Dr. Owen, for giving us a perspective of the Bill and Melinda Gates Foundation. Now to Emily Wainwright of USAID. Now, your country has been a vocal champion and one of the largest financial contributors to global NTD efforts. So what aspects of progress do you find inspiring?
The NTD community has shown the dramatic change that is possible for public health when the private sector, countries, donors, NGOs, and researchers come together around a common goal. I've been inspired by the dramatic progress achieved in such a short time. 10 years ago, much of what has been accomplished was considered aspirational. Since then, thousands of districts around the globe have been surveyed for multiple diseases. A handful of committed companies have donated billions of pharmaceutical products. And donors are providing approximately $300 million per year to countries so that over 1 billion people a year are reached. This is huge and a highly efficient global program that isn't just controlling disease, but eliminating disease.
And presumably, Emily, you see prospects for expanded partnerships under the new roadmap.
Many countries will achieve these targets for some diseases over the next 5 years if we stay the course. Looking forward, the new roadmap lays out a vision for completing the agenda, which will require expanding the partnership. 2 areas are critical. 1, we need to include more donors and manufacturers interested in innovation to develop better diagnostics and in some cases, new treatment strategies. But the single most important partnership to expand is the one with endemic countries. This is the most underutilized partner and resource. Governments are making investments in their NTD programs, but it could be so much greater, not just by increasing domestic financing, but better utilizing existing country resources within the health sector and across all sectors that benefit from eliminating NTDs. This is the most critical and essential member of the partnership if we want to see a world free of NTDs.
Emily Wainwright, thank you very much for those words on behalf of USAID. Let's now move to Tsitsi Masiyiwa. Now, you've often said you will invest in human projects that aim to help individuals lead a dignified and healthy life. But the key question for you is, how do we get to that? Can you unmute, Tsitsi, please? Can you unmute? We can see you, but we cannot hear you, and we want to hear your glorious voice.
Congratulations on the WHO Control of Neglected Tropical Diseases team for the launch of the roadmap, Ending the Neglect to Attain the Sustainable Development Goals. Thank you so much for this opportunity to be part of a very historical event. We will do our part as philanthropists from Africa to ensure that our aspirations to ending the neglect of NTDs by 2030 are achieved. Now, in order to promote a dignified and healthy way, we have to understand the complex and unique nature of the people who are right at the center of the problem that we are trying to solve. It cannot be a one-size-fits-all approach. So thankfully, the roadmap tackles the different diseases with the unique context of each country in mind. The roadmap strategic pillars foster the paradigm shift that is necessary for guiding how we interact with vulnerable and marginalized communities with dignity. We have to educate our communities on the root causes of their condition, and also empower them with the tools to prevent the spread of disease in their communities. Access to information needs to become a right. So what does dignity look like? It's when we empower our people to beat NTDs with a programmatic policy approach that addresses key issues so beautifully outlined in the roadmap. As the roadmap proposes, we need a cross-cutting approach where every sector and stakeholder is engaged. We, together within our communities, must develop partnerships that put our collective values of equity, fairness, and respect at the center of our work. And when we work together, we can beat NTDs. Thank you, Henry.
Thank you very much. And let me just ask you this supplementary. How confident are you that this approach can help in achieving those roadmap targets?
100%. I think the beauty of the approach is it's cross-cutting, is collaborative. And there's a willingness among all the key stakeholders to invest the necessary human resources that is needed and the capital in order to eliminate and tackle these diseases.
Thank you very much indeed, Tsitsi Masiyiwa, for all your philanthropy and your enthusiastic support for what we're doing today and going forward. Right, we're going to take a short break with this cross-sector photo story. That's the message. We can end NTDs, but it's got to be done through partnerships. And speaking of which, let's now go to Dr. Kizito Ogunsang, who is the director of NTD NGO Network. Here's a question for you. I mean, NGOs play a crucial role in supporting country-led programs. They also generate evidence for the uptake of strategy and delivery of a range of interventions for NTDs. So how is the network working to ensure successful partnerships?
Since its inception in 2009, the Neglected Tropical Disease NGO Network, or NNN, has placed partnership in its core as a forum for NGO partners working together to beat NTD. The NNN works to support positive impact through working with endemic countries under WHO guidelines. The NNN serves a unique role in partnership building. While its members are NGOs, NNN approach to membership is inclusive. Our annual meeting and working group includes donors, government staff, and researchers, enabling the sharing of practices and ideas. All partners can pick on common themes and customize them to suit country needs. NNN membership has grown substantially to over 80 members worldwide today.
Good to see that your membership is expanding, but what role can the NNN play in achieving the targets, the ambitious targets, of the new roadmap?
With the new roadmap, the NNN will provide a broad-based platform for action toward the 2030 targets and will serve as a community of practice for NTDs. On this year's Global Hand Washing Days, we made a commitment to hand hygiene for all. We are supporting the implementation of the WASH NTDs toolkit and are contributing to the WHO Global Strategy on WASH and NTDs, a companion document to the roadmap. These are some of the ways in which we are mobilizing cross-sectorial support from across the NGO community, governments, and donors.
Dr. Ogunsan, thank you very much. Now we're going to transition from NGOs to big industry, and Greg Perry speaks on behalf of the pharmaceutical companies. Let me ask you this question, Greg. I mean, your members have made a huge contribution to sustain the global scale-up of programs through the donation of medicines, which is commendable. But what are the key areas of partnership that have facilitated success?
Thank you very much, Henry. Indeed, this industry and, of course, a number of selected companies have a long-term commitment to combating NTDs, and as been mentioned by yourself and others, a substantial amount of investment made in donation schemes, in R&D, in supporting awareness, which is what we will continue to do. I think just a couple of overall points. Of course, what partnerships bring is enabling each and every actor to bring in their own competitive advantage, if you can call that, their own speciality into the project. And that is fundamentally important. That may sound just like a normal thing to say, but it's not. In the area of access and delivery, we have a highly complicated chain of supply and delivery, and that cannot be underestimated how difficult that is. So bringing in various partners in a holistic approach upon that is fundamental, and the reason why the industry has continued to make its commitments, and we have, there's been substantial investments over the last few years and increases in volume, is because of the strength of those partnerships. I mean, the partnerships are also bringing awareness. They provide leverage for political commitment, risk sharing, for example, in R&D, and they also help to attract funding. So all those aspects of it is very important. If I could just identify three key partnerships as examples, is the NTD Supply Chain Forum, and key to that is NT Delivery, which provides a sort of a centralized system for annual requests and information. So that is, companies find that key, and the platform it has with other stakeholders. There's also community-directed treatment programs. Probably the best known one is the Mectism donation program for fighting and eliminating river blindness and LF. And key to that is communities. The role of communities is fundamental, and our companies very much wish to express that and build on that. And another one, of course, is R&D collaborations, the most recent one being the FECSI that's combating sleeping sickness. 7 European countries, the Gates Foundations, MSF, DNDi, Sanofi, and governments on the ground. New innovative treatments, everyone working from the development, the registration, the delivery, the manufacturing, and the company committing to free doses as long as needed. So those are all the background there to why the partnerships are successful.
I think it's really important that you stressed all of that, Greg. I mean, we can see how partnerships and collaboration, from production to development to delivery, is being tested right now with the rollout of the COVID vaccines. We're seeing problems in the EU and the UK right now. So thinking about partnerships and collaboration, what new opportunities do you see in expanding that collaboration with the new roadmap over the next 9 or so years?
Yeah, first of all, I think it's important to say the industry fully endorses this roadmap, and we do see it as creating opportunities for building on existing partnerships and new ones, public-private, private-private, which I'll just come to, and also let's not forget public-private people, which is again communities. I think we're open to looking at sort of new approaches to the collaboration, looking at issues like implementing the sustainability and investment case that needs to be made, working on new access models, looking at how other parts of the private sector could co-finance and be involved in programs. There's been some interesting developments there where pharmaceutical companies working with other sectors of the private health care industry, like in diagnostics. And of course, we're open to increasing cooperation, anything at the last mile. But what I do want to emphasize is this: if we want to ensure greater developments and more impact, I think we've got to do a number of things. One, we should be looking at some sort of incentive mechanisms that are out there, whether it's advanced market commitments, whether it's priority review vouchers, and ensuring that we maintain funding for high risk phase 2 research. I think we need to look at streamlining regulatory procedures, data sharing and pooling, but we need rigorous monitoring and evaluation. We need strong domestic and community ownership, and we need, of course, domestic mobilization and a commitment at the national level that all of this is part of an overall framework for health.
Excellent. Greg Perry, on behalf of the IFPMA, thank you very much indeed for joining us. Let's move on now to the African Research Network for NTDs, and John Amwasi speaks on their behalf. Let me ask you this question, John. The WHO recommendations and guidance, including strategic documents such as the roadmap, are based on science and evidence. Got to follow the evidence, the science. What are your perspectives on the key scientific questions that need to be addressed over the next decade?
Oh, many thanks, Henry. It's a pleasure to be with you today. Now, before we even get to talk about key scientific questions, let's take a step back and talk about who is asking these key scientific questions that need to be addressed over the next decade. This is just as important as the questions themselves. Now, when it comes to NTDs, the disparities, which are the heart of these diseases, are also reflected in the opportunities available for posing these key scientific questions. Perhaps this also needs to be looked at scientifically. To pursue an integrated approach, instead of a disease-specific approach, as we have mentioned about this roadmap, we need to focus on the core of NTDs, poverty and disparities. We have come a long way in understanding this, but there is still a whole lot we do not know. So the application of socio-anthropologic research methods to investigating NTDs and informing the implementation of NTD control and elimination efforts will be critical. Second, the root insertion of COVID-19 into an already complicated health equation means now rather than later, and likely for a long time to come, we need to find out how NTDs interface with COVID-19 at various levels. I'll speak about two major levels. One, the medical level, where we seek to understand how the endemicity of NTDs impacts on risk for COVID-19 infection, severity of disease, implications for medical interventions, including the development of diagnostics. And the other level is more of the public health level, where we need to understand how COVID-19 has and continues to impact on NTD control efforts and how to mitigate these. And the third scientific question would be the fact that we have a roadmap that suggests that there is an end to the road. We need accelerated efforts to bring to the field novel diagnostics and medicines, which will help us go the last mile towards elimination and eradication. Without these, we will not be able to make it to the end of the road.
Thank you very much for that. What about this then? What role can your network, the African Research Network for NTDs, play in strengthening research capacity, because you were focusing on that, on the continent over the next 10 years? How can you influence things?
No, thank you very much, Henry. I think it's a really important question you ask, because the African Research Network for NTDs and our partners worldwide, I must emphasize, are in a unique position to provide the critically needed science and evidence required to inform the implementation of the NTD roadmap. This is because it involves leading Africa-focused researchers across the globe who understand from a very personal perspective how these diseases are affecting people, especially in low middle income countries. As Dr. Tedros already implied, we now have the map. It's now time to walk it. And the role the ARNTD could play with several partners is the following. We would like to be a robust and close to the action channel for providing funding support to the research agenda of African scientists. Also would like to be a loud voice, amplifying the sufferings of our brothers and sisters across low middle income countries, which we can appreciate in close proximity to them by advocating for the implementation of what we already know works and just putting that on the ground and improving the situation. ARNTD and our partners are looking to provide the catalyst and the strong linkages for improved South-South and North-South or South-North, however you want it, collaboration. We're already doing this, and we're collaborating with the USAID and the UK Aid through the core NTD to run the small grants program, which is already achieving so much in promoting and strengthening research capacity across the continent. And then finally, as a continent-wide network, we're interfacing with several partners across the globe, as I've already emphasized, and we're in a strong position to truly promote this integrated research approach or integrated approach, which has been espoused by this roadmap, by overcoming perennial barriers of language, geography, discipline, and disease as a network that cuts across the entire continent.
Thank you very much indeed to John Amwasi on behalf of the African Research Network for NTDs. You sound like you're really ready for this, so it's good to see the enthusiasm and the energy, and that brings our panel on partnership catalyzing success to a close. We're now going to take a short 5-minute break. I'm delighted to introduce, and this is great, the Tanzanian artist Mimi Mars for your entertainment.
My name is Abby Chams, and I'm a 17-year-old singer, songwriter, violinist, guitarist, and pianist from Tanzania, East Africa. And today I'm incredibly excited to be a part of this historical launch of neglected tropical diseases, this new roadmap from 2021 to 2030. And today, together with Mimi Mars, we will be performing for you a song called Haina Mana. Enjoy!
Haina mana, haina mana. Nijipoze na nini, umoyo umeunanipita pita, na kunywa nisahau bado yanakita kita kila siku. Kwa nini mimi kwangu mapicha picha asina angalau naonyesha kujali, aone nampenda mwenzake nisiumie, na kwamba kuruhusu kichwani aniingie, akacha kujali maumivu ya kutendwa mazima nivamie, ana kwamba na kwa yote ndio fanya kwake. Haina mana, haina mana, haina mana, haina mana. Kujishusha hata kama nikose, na bado msamaha nimwombe, kuzidisha upole nisionge, na bado mapenzi yanidode, na kama sina bahati naacha, maana utima shachoka maumivu ya kutendwa, na kama na kama sistahili naacha kupenda, naonyesha kujali, aone napenda, lakini we naonyesha kujali wewe, na kama sistahili naacha kupenda. Haina ma, haina ma, haina ma, haina mana.
much for watching this. I really hope you enjoyed our performance and that you will be amongst the champions working hard to eliminate NTDs towards 2030.
Fantastic, and welcome back, everyone. I hope you enjoyed that wonderful piece from Mimi, and I think it was Baby Chams. I didn't catch the name properly, but the violin was absolutely gorgeous as well. Now, we've had a few country perspectives, plus, examples of some of the interesting partnerships and partners that are needed, remembering that there is a need of both old and new partners going forward so that we can really turn things around for the future. Now, coming to the key part of the event, the new roadmap for neglected tropical diseases. And here to introduce this session is Dr. Mwelechele Malechela, the Director of NTDs at WHO. Dr. Mwele, one of the targets of the roadmap is that 100 countries will have eliminated at least one disease by 2030. How confident are you in achieving this within a decade? We lost something. Oh, there she is.
And mute has become the issue of 2020 and 2021, Patricia. Thank you for your question. I'm confident because I have a lot of confidence in the global NTD community, our partnerships and their enduring strengths, as you've heard today. My faith is also built on the comprehensive approach of the roadmap, which is underpinned by 3 fundamental shifts, which I believe will accelerate progress. So first, the move from measuring process to measuring impact. And this means there is a focus on accountability. Monitoring our progress towards the achievements of the roadmap targets will be a continuous process over the next 10 years, building on and strengthening existing data processes at all levels. And this will allow us to innovate and adapt and modify our programs to ensure success. So we will not be going blindly. And secondly, our focus in the next decade must be on combining our efforts and involving people and partners in meaningful ways and ways of working smarter. And this means integration with the health sector, within the health sector, cross-sectoral collaboration, which has been talked about a lot today, but at the same time, keeping patients at the center of it all. Third, and most arguably the most important shift, is to facilitate and uphold country ownership. The shift from partner-driven programming to country-driven programs will mean that interventions will reflect the needs on the ground and that they also align with the broader global development agenda with a focus on primary healthcare and universal health coverage. The new roadmap, Patricia, represents a new way of working. It represents a united vision, and which has been co-created by all of us over the last 2 years. So it belongs to us all. It belongs to everyone, those who have been involved now and who will be involved in the future, from heads of state to partners on the ground, funders, community health workers, youth groups, and of course, those people affected by NTDs. I've been fortunate to enjoy a long career in NTDs, and the courage and commitment of some truly inspirational people has never failed to impress itself on me. And that's why I feel such confidence, because I know this partnership will deliver the roadmap, because as always, we are stronger together.
Yes, that is so true. Thank you, Dr. Mwele. I'm also so delighted that we will now be joined live by Dr. Matshidiso Moeti, the WHO Regional Director for Africa. Good to see you again, Dr. Moeti. Now, having heard what Dr. Mwele has just said, countries in your region have considerable experience in developing homegrown innovation in tackling outbreaks and epidemics. We've seen this happen during the Ebola virus disease and currently, of course, with COVID-19. How can such lessons help to really strengthen health systems to support the new roadmap?
Thank you. Thank you so much, first of all, for the invitation. I'm excited to be here and delighted to reconnect with the NTD community after this immersion in COVID-19 for over a year. And I'm delighted that we are finally launching the new roadmap. So with many examples of work that, of the lessons that are work on outbreaks, including on polio, which has been declared as a public health of international concern, have to offer for our work to strengthen our health systems and to help them deliver for NTDs. For example, we know that we will in the end have to reach some of the most difficult to reach people and areas and deliver services to them. And polio here has some interesting lessons to offer. For example, in the insecure and inaccessible areas in the Lake Chad Basin countries, satellite imaging was used to quickly map settlements targeted for vaccination, and also were able to use that to estimate the target population up to 95% accuracy, even without physically visiting the areas to actually do a head count. And this enabled then the targeting, the quantification of what needed to be delivered to be much more accurate and to be done under these very challenging circumstances. In Nigeria, for example, again, another example from the polio work, geographic information systems were used to monitor service delivery and to ensure that vaccinators actually reach the targeted underserved and hard to reach communities and areas, and also those who supervise them actually get off the main road and go and reach those faraway villages. So this improved accountability and now being able to see where we need to take corrective action to make sure that we covered service delivery gaps. In doing polio campaigns, again, we took the opportunity to integrate and deliver other services such as deworming, treatment for diarrhea, micronutrients, etc. And we can take this lesson to integrate into how our health services work more generally and find all the opportunities to deliver NTD services. Thanks to our polio program, all of our member states are now using GIS system to collect data in real time on vaccine stocks, on surveillance, on the performance of routine immunization. So not only are there lessons, but there are also systems being put in place in countries that are available for the implementation of the roadmap. We've seen now in the examples of our Ebola experience in countries like Liberia, the development of tools like mHero is an electronic tool that was used to deliver health messages to communities. It's now an integral part of the ministry's health information system to communities work. And so what we've seen is that as we near the elimination of NTDs, finding the remaining pockets of people not yet reached will be extremely important. So technologies like satellite imaging, GIS will be useful. Innovations like appropriate low-cost technologies and integrated ways of working will also support implementation of this new roadmap.
So all super exciting. All super exciting, Dr. Mweti, with all these innovations that are going on and how they'll, benefit the implementation of the actual roadmap. So thank you very much, Dr. Mweti, for that. Now, between 2003 and 2005, Germany was instrumental in bringing together the scientific community by providing a platform for discussion and reconciliation of different views and opinions to lead the global NTD program. Now, earlier I spoke to Dr. Maria Flaxbart, the Parliamentary State Secretary to the Federal Minister for Economic Cooperation and Development in Germany, and asked her if she saw an opportunity for her government in further promoting One Health and strengthening global action to tackle the rapid expansion of vector-borne diseases. Listening to what Maria had to say.
What we have achieved on the basis of the first roadmap from 2012 lets us to look with optimism to the future, with a view to sustaining and expanding the progress achieved over the last decade. We now need to work through an aligned cross-sectoral approach, shifting our focus from the disease-specific programs of the past to an integrated approach combining various measures to combat NTDs and mainstreaming them in national health systems is taking us in the right direction. When it comes to vector-borne diseases in particular, the One Health approach will enable us to better dovetail measures from human medicine, animal medicine, and environmental science. The BMZ has recognized the close link between healthy animals, healthy people, and a healthy environment. We cannot achieve one without the other. That is why we have set up a new directorate for global health, pandemic prevention, and One Health, thus giving the One Health approach within the BMZ an institutional and technical structure. We expressively support the increased tripartite cooperation between OIE, FAO, and WHO and the United Nations Environment Programme. Challenges are becoming more complex in our globalized world. A growing world population, climate change, increased mobility, degradation of formerly untouched habitats, and non-sustainable agriculture practices are increasing the risk of exposure to newly emerged pathogens. Vector-borne diseases too will spread further, so our answer must be part of a One Health approach. I strongly believe that the new NTD roadmap is giving us a good tool. We are ready to tackle the new challenges, and we are looking forward to continued good and successful cooperation with all partners.
About what we do and why we do it.
Today, we make a pledge
to stand with the 1.7
billion people suffering from neglected tropical diseases,
to support the World Health Organization,
to work with countries
and partners around the world,
to deliver the new
roadmap,
to rise to the
challenge, to end
the neglect,
because together we are united to combat NTDs.
The director of Pan-American, Health Organization, and the regional director for WHO AMRO. Also with us, Dr. Ahmed Al-Mandari, the WHO regional director for the Eastern Mediterranean region. Gerald Chirinda, youth combating NTDs, and Dr. Canisius Kanangire, the executive secretary for the African Ministers' Council for Water. Welcome to you all. First, Dr. Carissa Etienne, a question for you. Quite the varied landscape that you cover in both your professional roles. And what is your vision for NTDs in the next decade in your region?
So thank you for this question. And let me begin by saying that we at the Pan-American Health Organization enthusiastically welcome the launch of this roadmap for NTDs. And I want to congratulate all of the partners and international community. This launch marks what is a major catalyst to boost our joint efforts. Our own vision for the next 10 years is that many more of our countries will build on the elimination agenda that we have. Since 2013, 4 countries have eliminated onchocerciasis. So there's only one focus remaining in the region, and that's among the Yanomami population. We have seen eradication in many countries of lymphatic filariasis, trachoma, human rabies transmitted by dogs, etc. So I am looking for further elimination based on a plan of action that we have to eliminate several conditions and NTDs by 2030. So I have great hopes for the Americas based on the fact that the governments of the Americas have committed to this. We have strong experience in elimination of NTDs. We have built the multi-sectoral networks. We have strong partnership and strong primary healthcare approaches that emphasize care for the population that is marginalized and providing that surveillance that is necessary, because you'll need to continue. We have the targets, but we need to build up the local level, both at the national, but also in the local level to ensure that they meet these targets. And that needs tenacity, and that requires commitment at all levels. Over.
Thank you so much there. To Dr. Mandari now, recently, many countries in the EMR have made substantial progress against NTDs. Tell us how this was achieved in spite of the challenges that many of them are facing.
Thank you very much, Madam Moderator, for this important question. And in fact, if I just may start by sharing with you, as you all know, EMR region is composed of 22 countries. 2/3 of these countries are undergoing either acute or protracted emergencies, with whatever sort of consequences of these emergencies on healthcare systems and other systems in the country. However, in spite of that, as you said, a lot of successes have been made. And just to share with you an example of countries which we consider are stable, but at the same time countries which are considered with emergency and or fragile healthcare systems. Like, for example, when we talk about trachoma, Oman, Morocco, and Iran eliminated trachoma, and they have been certified 2 years back. Egypt and Yemen as well, they managed to eliminate lymphatic filariasis. Then soon, when it comes into trachoma, Tunisia, Saudi Arabia, and Iraq will be validated for elimination of trachoma as well. And at the same time, I'm proud to say that Saudi Arabia, Egypt, Morocco, Iraq, Iran, and Oman are on the edge, if I may call it, of eliminating schistosomiasis soon. In addition to these achievements that I have just shared with you, we are proud to say that more than 18 million people here in EMRO receive treatment against different types of NTDs annually. These achievements, as you said, in spite of the challenges EMRO countries are facing, due to many reasons, I just may mention some of these. One of them, and top in the list, is the strong political commitment that we have seen from top leaders, as politically speaking, as well as top leaders in the healthcare system at different levels. The second reason, if I may just call it, is the dedication of healthcare workers. We have seen a full commitment of those healthcare workers going into, sometimes bare feet, fighting these diseases in different geographical areas, and some of them are inaccessible. At the same time, and I must say it here, and I'd like just to send a word of thanks and appreciation on behalf of EMRO, WHO, and member states and communities, the generous support we received from all partners and donors. And I am just pledging all donors and partners to continue that much support, invaluable support, which is saving lives, eliminating suffering of the people. We are hopeful that at this global commitment to achieve the sustainable development goals for neglected tropical diseases and universal health coverage targets will consolidate our gains in the countries to end NTDs, as you have mentioned, in earlier discussions, by 2030. So thank you very much for this question.
EMR has the highest global burden of cutaneous leishmaniasis. What additional support? Let's talk a little bit more about that. What additional support is needed to achieve the target?
I'm in a conference now, and I must speak.
Thank you. Although I can hear some background, but I mean, this is also another important question. And I may say that, as you said, our region carries in numbers nearly 75% of the global cutaneous leishmaniasis burden. The disease, unfortunately, is endemic in 18 out of the 22 countries we have. And annually, member states in the region report more than 150,000 cases. And we noticed that it has been increasing for the last few years. There are critical technical and financial gaps, that will or still, continuing hindering us from case management, vector and animal reservoir host control. To improve the case management, just answering your question, we need affordable and more sensitive point of care rapid diagnostic tests. It is very highly needed, especially as you know, many of our countries are undergoing, these sort of emergencies with fragile healthcare systems. We also need easy to administer, safe and effective treatment, which can be used in health centers and even at a community level, in which, especially in communities which access to hospital is a bit difficult. Better therapies such as cryotherapy, for example, or thermotherapy, I feel are underused in highly endemic areas because of their high cost. So this is something that we may start working on. And here I'd like to call also donors and partners support. Countries should be supported to scale up these effective treatments. If we want to say, yes, we are making major achievements on that area. Today, we do not have tools that work effectively to control the vector and animal reservoir. And this is another field area where applied research needs to be strengthened and needs to be done to identify the solution in a very innovative and creative way that will definitely help communities, especially communities with limited resources, communities undergoing emergencies, communities with fragile healthcare systems, communities having difficulties in accessing the healthcare system. So these sort of things that I thought to share with you, answering your question. Thank you very much. Back to you.
Frozen. Okay. I'm going to move to you now. Thank you, Dr. Almandari. I'll move to you now, Dr. Kanangire. How will the new roadmap support efforts to ensure collaboration between WASH and NTD stakeholders to help end NTDs?
Thank you very much, Patricia. First of all, I wish to congratulate WHO for this very important document. On this question, the first thing I want to remind ourselves is that with more than 7 of the WHO listed NTDs linked directly to poor water and sanitation services or poor development of water resources, I think the water community is really put to task to collaborate with other partners to address all these issues. And the water fraternity say that water is life and sanitation is dignity, finds its full sense in the prevention, elimination, control, and eradication of NTDs. The water sector will need absolutely to contribute to this roadmap by ensuring, first of all, universal access to clean water, access to safe sanitation, starting with ending open defecation, and ultimately providing access to safely managed sanitation and access to hand washing facilities with clean water. And AMCA, as the leader in this water and sanitation sector, we have been intensifying advocacy and creating synergies towards provision of water and sanitation services, promoting behavior change, building capacity at all levels, and addressing inequalities and inequities. And also we have been urging our member states and our development partners to focus on these key strategic actions so that we can create impact as far as water and sanitation services are concerned. And more recently, we decided to tackle wash bottlenecks from the root by developing the African Sanitation Policy Guidelines that will help African countries to develop policies which are aligned with SDGs and other high commitment that have been taken by our head of states and other high-level leaders. And we think that WHO NTD Roadmap is a great opportunity for us to strengthen the already existing collaboration and especially create synergies between WASH and NTD around the pillar, which is to intensify cross-cutting approaches. So on this, we want to strengthen collaboration and synergies. One, on policy improvement to address issues of water related to NTDs and prevention and control. Second, we want to undertake joint actions, especially with relation to monitoring and reporting joint sector progress that we will be making on this and build capacity to address behavior change. Third, we want to establish a WASH and NTD collaborative platform that will steer our joint collaboration and ensure that we are really contributing to the roadmap. And lastly, the WASH sector will want to add the End NTD to End Open Defecation campaign so that we can create knowledge in our constituencies and motivate them to work together for the same cause. We believe that if we do this and work together in the new approach and also make sure that we secure adequate political will and dedicated resources from each national country, we will be able to focus all those actions and indeed contribute to addressing issues and reaching the roadmap targets. I thank you.
Thank you very much, Dr. Kanangire. Aspects of this roadmap is to work with everyone. It also means engaging with young people across the 5 continents. And as you know, approximately 42% of the global population are under the age of 25, making it the largest youth group generation in history. Gerald Chirinda, I'll bring you in here. What are the ways in which youth can play a role in driving change for communities affected by NTDs?
Thank you so much, Patricia. And, before I answer the question, I'm particularly excited about, this specific roadmap launch, because I'd like to believe it is the first time that young people are part of not just the launch, but have been a part of the process that has led to this. So it's definitely a step in the right direction. Now, to answer your question, there are 3 particular areas, which I believe young people can drive change and bring about change in their communities. The first one is the area of accountability organizing. So that essentially is holding office bearers accountable for commitments that they would have made, whether it's at a particular platform to end NTDs. I think that the issue of accountability is an important one, and one where young people have been seen to be quite effective in terms of doing that. As a movement, we are also engaged at a policy level with regional and international bodies in collaboration with other youth networks within these particular regions. So we are playing a key role there to make sure that, before heads of state or ministers commit, we have it down on paper, we have it down as policies and communiques that we push forward. We are also engaged in engaging young elected officials and with the aim of creating engagement platforms for them with young people, as well as with the content and the material of neglected tropical diseases, as most of them are not, generally aware of NTDs. The second issue is the area of education and awareness. So young people can play a key role here in bringing about awareness of basic treatment, prevention measures, and available health programs in as far as NTDs are concerned within their communities. I was quite inspired when we essentially youth combating NTDs in February last year in Tanzania. There's a group of young people that came to us and they said that they were actually setting up an NTD club at their school. So I think these are, incredible ways in which young people can engage. We also recently carried out a storytelling competition. And, initially we were thinking, okay, not a lot of young people know about NTDs, but we were amazed at the number of young people who actually engaged in the storytelling competition itself. Across the 4 categories, I think we had close to 1,000 applications, which just goes to show, the potential that exists in actually telling the NTD story and telling it in creative ways. The last point is on innovation, Patricia. Young people are innovators as well. They have the ability to innovate, so we need to be able to harness that ingenuity that, young people carry across the different value chains of neglected tropical diseases, whether it's working with, health structures and carrying out practical problem, troubleshooting of existing issues that are within the programs in various countries. They can play a part there. We have within our networks, as an example, young ladies who are developing a platform to, communicate health-related issues to their communities using mobile phones in their local languages. We also have, across various sectors, young WASH innovators, young people who are engaged in last mile delivery, as well as diagnostics. But lastly, what is important for this success and for these young people to be effective and successful in what they do is partnerships. And as Youth Combating NTDs, we are humbled by the support of the Uniting to Combat NTDs partnership, the relationship that we have with WHO, and the enthusiasm and energy that we have seen coming from young people across various youth networks who are willing and are keen to collaborate with us. So, that essentially those are the areas that I see young people playing a role in driving change within their communities. Thank you.
Always giving great direction and vision there, Gerald. Thank you so much. We'll be heading over to UNICEF now. One of their key mandates is education. And we spoke to Dr. Andreas Hassmann, who's a nutrition specialist, and asked him the following question: how can the fight against NTDs improve educational outcomes?
UNICEF Nutrition and UNICEF Supply Division work closely with WHO to address the burden of soil-transmitted helminthiasis in a collaboration that showcases several of the key features of the new NTD roadmap. STH has serious negative impact on children's nutritional status. It impairs cognitive development, and it causes the loss of millions of Dalis every year. And as you know, WHO recommends preventive chemotherapy as a temporary measure to control morbidity. Preschool-age children are reached with preventive chemotherapy, typically delivered with vitamin A supplementation in integrated cross-sectoral campaigns known as Child Health Days. UNICEF and WHO work closely together to ensure minimal fragmentation and optimal coordination across programs and to increase coverage. Currently about 55% in the 92 countries where preventive chemotherapy is needed.
Sorry about that. What are the main challenges going ahead, Dr. Hassmann?
This level of coverage is obviously not satisfactory, and there's still significant work for us to do in the years ahead. An important reason for stagnant coverage in recent years of both vitamin A supplementation and preventive chemotherapy is the loss of delivery platforms. Polio campaigns have become less frequent in some countries, and other countries have struggled to fund integrated campaigns. It has therefore been necessary for many countries to move delivery from campaigns to routine contacts. and high coverage has not always followed.
Roadmap contribute to overcoming such challenges?
COVID-19 has presented additional challenges to coverage. It is beyond question that an integrated approach, implementation research, cross-sectoral collaborations, and other initiatives that the roadmap sets out are the way forward. At UNICEF, we look forward to continued collaboration with WHO in the area of neglected tropical diseases.
To add some good news about WHO's deworming program, the pharmaceutical company GSK yesterday announced an extension until 2025 of its donation of albendazole to WHO's global program against intestinal worms. And another piece of good news is from Novartis, the other pharmaceutical company that has been donating medicines for leprosy since the 1980s. They are also renewing their medicine donation agreements to WHO for another 5 years from this year. A big thank you to all our panelists for their valuable contributions. And of course, thank you to both GSK and Novartis for that extra special news on this day.
Thank you, Patricia. Asante Sana for handing back to me with such tremendous news. We want to see collaboration, we want to see production, we want to see engagement, we want to see an end to NTDs. And as we build toward the launch, I'm delighted to introduce our first keynote speaker, who is Her Excellency Madame Isatou Touré, Vice President of the Republic of the Gambia.
Thank you very much, Mr. Moderator. Good afternoon, Your Excellencies, ladies and gentlemen. I am here to show my full support to the official launching of the new WHO roadmap of the NTD 2021 to 2030, ending the neglect to attain the Sustainable Development Goals, a roadmap for neglected tropical diseases 2021 to 2030, which charts a clear path towards ending these diseases that affect a significant part of the global population. 1.7 billion people affected is a truly significant proportion of our planet that deserve our unwavering support and attention. Women and girls bear the biggest impact of these diseases. In the Gambia, women and girls constitute over 50% of the farming community. The impact of NTDs on these populations cannot be overstated. Their lives and livelihoods have been disproportionately affected by NTDs, and this has affected their productive and reproductive lives. I am personally passionate about improving the lives of women and girls worldwide, and combating neglected tropical diseases is one of the most practical things that we can do to improve the lives of women and girls. The level of progress that we have made in NTDs fills me with greater optimism for the success of this new roadmap. This includes the elimination of at least one NTD in 42 countries and 1 billion people being reached with treatment for at least one NTD 5 years in a row. The Gambia has demonstrated tremendous commitment towards the control and elimination of NTDs. In 2020, the Gambia submitted the dossier to WHO requesting validation of the elimination of trachoma as a public health problem. We hope to join the growing list of countries that have eliminated this disease, which is a leading cause of blindness worldwide, and to contribute to WHO's new roadmap target of 100 countries achieving elimination of at least one NTD. The National Surveillance System, under the guidance of the Honorable Minister of Health, has in place active disease surveillance systems that tracks all diseases and reports on a weekly basis to all partners and stakeholders. We are committed to continue these programs in our communities. I am very encouraged that the focus of the new roadmap on multi-sectoral collaboration and cross-sectoral partnership
To reach our 2030 goals, we have to address the root causes of these diseases, such as lack of access to clean water and sanitation. I am also encouraged by the focus on country ownership and leadership as a gateway to sustainability. We as a country are committed to the implementation of the new NTD roadmap, and you can count on Ministry of Health towards the global fight against NTDs and on me as an ardent advocate. I wish to take the opportunity to congratulate the WHO and its partners for escalating on this roadmap to move it forward. Congratulations. Thank you very much for giving me the opportunity.
Thank you very much indeed, Madam Vice President, for that message of support from the Gambia. Indeed, we're getting support coming in from all over the world on behalf of this new roadmap. Indeed, our next speaker is the Prime Minister of the Kingdom of Belgium, Alexander De Croo.
Ladies and gentlemen, it's exciting to be part of the launch of this new roadmap. It was in 2017, in my capacity of Development Minister, that Belgium announced its commitment to eliminate the neglected tropical diseases, together with the Bill and Melinda Gates Foundation, together with partner countries. So today's launch is an important new step. In the last couple of years, great progress has been made. In countries like the DRC, for example, thanks to crucial political support, especially from the Ministry of Health, sleeping sickness is no longer a general threat to public health. More in general, we've achieved positive results, thanks to improved diagnosis, better treatment, and digitalization. I want to emphasize today how crucial these digital tools have been. Thanks to better data collection and enhanced vector control, the action radius has dramatically expanded. Over the last 5 years, over 1 billion people were treated for at least one NTD. In the last decade, 600 million fewer people required an intervention against NTDs, and 42 countries have eliminated at least one of these diseases. Last year, out of 1.9 million people screened for sleeping sickness, a mere 383 cases emerged. Most of the drugs available are free of charge, and that is thanks to the largest private partnership in history. Together with the perspective of new drugs and single-dose treatments, this is hopeful news that should be celebrated. But more work needs to be done, hence the importance of this new roadmap. Hence why we need to keep on investing in better healthcare.
Tell me.
I want to use this opportunity to reiterate Belgium's commitment to play its role in the production of diagnostics for NTDs, to make them available in all affected African countries. Together with all partners, we are on the right track to eliminate the spread of sleeping sickness by 2030. The past has taught us not to be complacent. A lot of these diseases will re-emerge if we don't finish the job. COVID cannot get into the way of this goal. The pandemic has put a huge strain on our health systems and in our budgets. But the response to COVID has also shown what is possible when the world rallies around improving healthcare systems. We should take heart from this in the fight against NTDs. And that is exactly what we will do to eliminate them once and for all.
Merci beaucoup. Thank you very much, Prime Minister De Croo, on behalf of the Kingdom of Belgium. Now, a keynote address has been provided by the First Lady of Burkina Faso, Her Excellency Madame Sika Belle Kaboré. As Her Excellency is currently out of the country, her speech will be read by Professor Charmaine Ouedraogo, Minister of Health of Burkina Faso. Honourable Minister, you have the floor. Okay. Thank you very much indeed. Sadly, Professor is not going to be able to join us. So we're building up to that moment, and that brings it forward slightly because it's a moment we've all been waiting for, the launch of the 2021 to 2030 NTD Roadmap.
The NTD Roadmap for 2030
presents a strategic vision for the next decade
to protect more than 1.7 billion people.
This roadmap is a culmination of an extensive consultative process.
It has involved regions and countries,
stakeholders, partners, and academia.
who provided advice and input.
This widespread collaboration
has given us a truly united vision.
It was conceived, developed, and written by many of you here today.
This roadmap is our collective vision
that will benefit global health systems.
A blueprint for the next 10 years.
This roadmap aims to facilitate the work of countries, donors, partners, and stakeholders.
And above all, encourage collaboration across diseases.
A vision that is people-centered, country-driven,
and impact-oriented, with clear-cut goals and targets.
And these are
a 75% reduction in the disease burden due to NTDs,
90% reduction in the number of individuals requiring intervention due to NTDs,
aligned with sustainable development goals,
and the eradication of 2 diseases. It is a vision that will keep people healthy.
As we launch this roadmap,
we pledge
to change lives for good.
So there you have it, the launch from Drs. Mwele and Tedros. So you know what it's about, you know what the roadmap is intended to achieve in the next 9 or 10 years. And I did say that support and commitments are coming in from all around the world, and I meant it. And I'm delighted to say that we have, as our final keynote speaker, His Excellency President Paul Kagame of Rwanda. Okay. So sadly, he's unable to make it. I thought we were able to get a message from him. Sadly not. Okay, so let's talk about this. What exactly do we want to achieve over the next 9 years? Well, there are commitments and there is a call to action. So let's see them now.
Italy shares the feelings and vision of many nations still affected by NTDs. Good luck for the new roadmap.
Our community stands ready to support the implementation of the roadmap by strengthening the evidence base to support new strategies.
Since 1986, we have averted at least 80 million cases of guinea worm disease.
We need to focus, act with urgency, solve the problems from root cause, and support endemic countries to achieve their goals.
The spirit and aspirations of the roadmap is aligned with our quest for universal health care, which calls for increasing coverage.
The Skin NTDs cross-cutting group is totally committed to the roadmap's principles of sustainability, accountability, and cross-sectoral partnership.
It is essential that we combine efforts and invest in collaborative approach that build capacity and promote sustainability and resilience within health.
Delivery of this roadmap will only become a reality with strong leadership and collaboration.
The GSA is committed to ending NTDs and supporting health for all.
We are excited about the recognition of the broader needs of patients.
Our commitment to the new roadmap is to continue cultivating and catalyzing R&D and open innovation, also working with our global stakeholders on access and delivery or partnership and delivery.
We are ready to deliver the new roadmap to support country-led decisions for STH elimination.
We will work to ensure that our 2030 strategy for zero leprosy is in alignment and that our work will enable reaching the targets.
I hope that our network can continue convincing the German government to commit themselves even more than before to the support of this crucial development.
We look forward to working closely to identify opportunities for integrated responses and interventions that can expand access to equitable and affordable care for those in need.
We clearly cannot attain universal health coverage without addressing the burden of neglected tropical diseases.
This is a tumultuous time for global health, but as chairman of the Diet Task Force, I will do my best to lead and strengthen Japan's contributions in eliminating NTDs once and for all.
The launch of this roadmap is an important step in our journey together.
One step, but let us make it a major step together for One Health, and together help better the lives and livelihoods of future generations.
USAID will support the roadmap's call for sustainable NTD programs by reinforcing country leadership, strengthening health systems to deliver NTD services, and improving multi-sector collaboration.
We are very happy to collaborate with our colleagues from the Neglected Tropical Diseases Department to make sure that neglected will be a word that hopefully one day we can delete from the acronym.
We're fully committed to help achieve the global targets for 2030. We look forward to continuing our collaboration to end the neglect.
As recommended by the National Health Commission of the People's Republic of China, I'm honored to deliver this speech. First of all, I would like to congratulate the virtual launch of the new WHO roadmap for NTD. At Core NTD, we're thrilled to see research as a component of WHO's new roadmap. We are committed to working with our partners, especially those in the countries where NTDs are endemic.
Collaboration between health, WASH, and so many other sectors is crucial to achieving and sustaining targets, as well as continuing to build resiliency within our health systems.
To support the new roadmap, we will continue to steward the donation of preventive medicines, facilitate operational research to overcome barriers.
FGS is thought to be a risk factor for the transmission of HIV, and I'm deeply concerned that up to 56 million women in sub-Saharan Africa have FGS. We must expand and integrate FGS, HIV, and sexual and reproductive health services. We must increase access to medicines that so many women urgently need.
Ensemble, nous pouvons arrêter la trypanosomiase humaine africaine. Nous pouvons mettre fin aux MTN et contribuer à une meilleure santé pour tous.
What makes us especially happy is to see that people who are affected by NTDs are part of the strategy. They will be involved, they will be drivers, they will be owners of the strategy and also of the implementation. So thumbs up for WHO and for this roadmap, and let's all try to implement this exactly as it is written.
Through continued collaboration, the new roadmap goals are well within our reach.
Its cross-cutting approaches, proposal for change in systems, and reaffirmation of the importance of stronger accountability transpire the spirit of the SDGs.
This year has shown us that we need collaboration at government, organisation and individual level to tackle these big global health challenges.
O povo é a razão da existência do governo.
And remain committed to being the scientific home for the discussions, debates, and partnerships that not only take us to success in this year, but in the next decade to come.
Now Sudan is heading to a new era of controlling, eliminating, and eradicating NTDs.
In many cases, NTDs prevention solutions are cost-effective while having a huge impact on health and dignified life of those affected.
The UK was an active partner in the WHO consultation to develop the roadmap. We fully support its ambitions to protect people from the pain, disfigurement and poverty caused by NTDs.
As we begin a new era of collaboration to end these preventable diseases, we remain committed to working with WHO and our many partners to realize a world in which all people have equal chance to live healthy, dignified lives.
We are excited to welcome a new, ambitious roadmap that will facilitate cross-sectoral research and evidence-based innovation to accelerate NTD progress.
Somalia remains committed to achieve the Sustainable Development Goals target for the neglected tropical diseases. Therefore, we embrace the new NTD Roadmap 2030.
We at the Canadian Network are thrilled with the launch of the new NTD Roadmap.
Canadians ending the neglect.
Entendant perpétuer la longue tradition francophone de lutte contre les maladies tropicales, nous nous associons aux efforts déployés par l'OMS et aux objectifs de la feuille de route 2021-2030 pour la lutte contre toutes les maladies tropicales négligées sans exclusion.
I'm here today to express my organizations and my own full support to all efforts conducted globally and across the African continent to improve health and to achieve the UN Sustainable Developmental Goals.
I
congratulate my sister Muele, the entire NTD family, the Global Malaria Program, the malaria fighters will stand with you, learn from you, and walk this path to 2030 together with you.
EU appreciates the new roadmap for NTDs, and we recognize and further encourage the efforts to build a strong monitoring framework to evaluate progress. Colleagues, we have a long road ahead, but now we have a roadmap. So let's get moving.
We're all excited to see the new roadmap reaffirm WHO's commitment to eradicating yaws and for the first time introduce targets for the control of scabies.
We are so pleased to join the global fight to end the scourge of neglected tropical diseases, and we look forward to working together with the NTD community to make this a reality.
L'Organisation mondiale de la santé vient de lancer une feuille de route pour les maladies tropicales négligées. La France la soutient sans réserve. Nous allons continuer à l'appuyer. C'est nécessaire si nous voulons réaliser les objectifs du développement durable à l'échéance de 2030 et la couverture de santé universelle. Bravo l'OMS.
We'll be by your side every step of the way over the coming decade to make sure this vision becomes reality.
Rabies control and elimination can actually serve as a role model for intersectoral cooperation, in particular between the human health and animal health sectors.
As we launch the global NTD roadmap, I would like to reiterate the political commitment and national leadership in Sri Lanka to end the neglect for achieving SDG 3.
This roadmap has identified and set out clear targets and milestones to prevent, control, eliminate, and eradicate 20 NTDs in the next decade. I congratulate WHO on the roadmap and call on all partners and stakeholders from across sectors to come together in partnership and to end the neglect.
It's such an important day. It's a critical report and plan. And although it's ambitious, I know that working together with endemic countries and all the other partners, we can do this.
We want to see a world free from NTDs.
At the NDI, we would like to express our full support to the NTD Roadmap 2030. We believe that partnerships are critical to achieve the ambitious goal to control and eliminate NTDs.
Government of Nepal is committed to strengthen the national health system, increase financial resources for health, and enable equitable access in all aspects of treatment, care, and support for patients.
Let us all rally behind the roadmap and foster universal access to innovative and affordable responses to NTDs by 2030.
The Japan International Cooperation Agency welcomes WHO's new roadmap on the neglected tropical diseases. I'd like to call on all partners to join forces to end NTDs now.
We really applaud the WHO for the leadership that they are taking. The new roadmap, I think, will be very significant. I think together we can make a big difference in neglected tropical diseases.
Greetings on this special day. Good luck to everybody as we together move towards universal health care for all. Thank you.
So a series of commitments there, mobilizing towards a real call to action. I'm delighted to say I can add one more heavyweight voice to those you've just heard, His Excellency, President Paul Kagame of Rwanda.
Excellencies, Director General, distinguished ladies and gentlemen, I'm very pleased to join you to help launch the roadmap for ending neglected tropical diseases. I congratulate Dr. Tedros and the World Health Organization for giving much needed attention to this topic despite the urgency of the ongoing COVID-19 pandemic. Historically, these diseases have been neglected because they happen to be endemic to poor countries. These diseases cause pain and long-term disability. They also prevent children from reaching their full potential, both cognitively and physically. So it is very important that the international community is rallying around this agenda for a decade of action to achieve the Sustainable Development Goals. In Rwanda, we have integrated NTD medication into the national supply chain down to the community level. We are also in the process of certifying the eradication of sleeping sickness in Rwanda. The fight against NTDs is part of the broad agenda to strengthen national health systems and achieve universal health coverage. The health systems that serve to combat pandemics such as COVID-19 or HIV/AIDS are the same institutions that lead the campaign against NTDs. Investing in health is very good value for money. In this regard, allow me to stress the importance of increasing domestic financing for health, especially in Africa. Domestic health financing is a priority for the African Union, and progress is being tracked across member states on an annual basis. This effort is intended to complement the partnership funding, which has made such a difference in Africa, and to make those partnerships more sustainable. Rwanda will host the Malaria and NTD Summit in Kigali in June on the sidelines of the Commonwealth Heads of Government meeting. This gathering will be an opportunity to advance the commitments under the roadmap, and I invite you all to participate. It is possible to eliminate neglected tropical diseases within a generation. This roadmap shows us how, and now we must get to work and implement it. I thank you very much.
President Paul Kagame of Rwanda. And if you would like to join President Kagame and all those who are registering their commitment to the new roadmap, please sign in your name and organization or country at slido.com. Remember, the hashtag is NTD Roadmap. Please join this movement as we mobilize towards 2030, ending NTDs. Now, earlier, you may have seen a very enthusiastic young man called Gerald Chiranda from Youth Combating NTDs. Now, he and his team have been looking ahead to 2030 to imagine a new generation free of NTDs.
The year is 2030 and we are here to celebrate the victory against NTDs. It's been a long road, but we can safely say that it has been a rewarding one. These are just some of the successes to the NTD roadmap that we are reporting on today. The people requiring interventions have reduced by 90% to 200 million. 100 countries have eliminated at least one NTD. 2 NTDs have been eradicated, and these are guinea worm diseases and yaws. Here is a clip from 2021 where I interviewed some young people who at the time were imagining 2030. Let's see what little Golpo from Bangladesh has to say.
Hi, my name is Golpo. I am 7 years old. You guys need to take action because we can't grow up in a world of NTDs.
As a young advocate, I know the power that advocacy brings in highlighting issues that affect people. And guess who else agrees with me? Rijvi from Bangladesh.
Hello, my name is Rijvi Arifin, and I'm the co-founder of youth-led global nonprofit Awareness 360. Advocacy is an impeccable tool to raise awareness about the NTDs, break stigmas around them that are prevalent in our communities, and hold relevant stakeholders accountable for their commitments. At Awareness 360, we have been leveraging on the advocacy skills of young people across 23 countries. And by 2030, we want to make sure that the NTDs become a thing of the past.
You see, advocacy is not just about us carrying placards and yelling that we want things and we want them now. Well, they say prevention is better than cure. And with access to clean water, it is achievable to keep the NTDs away. Here's what Madhav, all the way from India, has to say.
At Clean the Gene, we've combined technology, data, and chemical-free filtration to build low-cost water purification devices that currently help over 40,000 people across 3 regions get access to safe and usable water. These completely energy-independent devices filter over 14.4 million liters of water annually and save affected communities a cumulative of 15,000 hours of walking every day. By 2030, I imagine that such water access technologies would impact over 10 million people and households across 18 countries in Africa, South Asia, and Southeast Asia, thereby playing a part in eradicating and eliminating NTDs.
Thanks, Madhav. I'm sure your solution will reach not just millions, but billions of people. Pharmaceuticals are at the forefront of the eradication of NTDs. Let's hear some thoughts from Purity, joining us all the way from Kenya.
I look forward to advancements being made in drug research and development, which means newer drugs and improved dosage forms of existing drugs. I also look forward to continued mass production and mass donation of NTD drugs, coupled to secure and strong supply chains to ensure that these drugs actually reach the very people that they're intended for. This would mean we have higher chances of freeing more people from these debilitating diseases.
And that's the kind of news broadcast I like. Thank you very much indeed to Youth Combating NTD. So let's hope we can realize your dreams and those ambitions in the next 9 years. So that concludes our launch of the 2021 to 2030 roadmap on behalf of WHO. And on behalf of Patricia Amira in Nairobi and me, Henry Bonsu, here in London, I'd like to thank all those of you who've collaborated with us on this endeavor, all the partners at the WHO and beyond, the technical teams in Nairobi, London, and Geneva. Keep in mind, combating NTDs, ending it within a generation. And until next time, thank you very much and goodbye.